Hello everyone, my name is Ashley Lamar. I'm a trauma injury prevention specialist at JPS Hospital here in Fort Worth. Today I'm here to raise awareness about the effect this COVID-19 pandemic is having on intimate partner violence. Intimate partner violence is the abuse or aggression that occurs in a relationship with a current or former partner or spouse. There are 4 different behaviors that are common in IPV relationships, and those are physical violence, sexual violence, stalking, and psychological aggression. Physical violence is what is most commonly associated with IPV. Physical violence often causes assault-related injuries as a result of hitting, kicking, punching, shoving, or other injury mechanisms. And sexual violence is forcing or attempting to force your partner to take part in a sex act, sexual touching, or non-physical sexual events such as sexting, or if the abuser threatens to share intimate photos and details of their sex life. And then we have stalking and psychological aggression, which consists of verbal and nonverbal attempts to exert control of another person by either mentally or emotionally manipulating the abused individual. So IPV is fairly common. You can see in this slide that roughly 1 in 5 women and 1 in 7 men have experienced physical violence at some point in their lifetime, as well as 1 in 5 women and 1 in 12 men experiencing some form of sexual violence. The rates of IPV in Tarrant County are slightly higher than the national average, with 1 in 4 women and 1 in 7 men reporting experiencing some form of IPV during their lifetime. Although intimate partner violence is commonly associated with women, it does occur in men as well, as seen by the statistics above. IPV is present among all delineations of groups based on gender, race or ethnicity, sexual orientation, socioeconomic status, and the like. When most people think about intimate partner violence, they think of the immediate effects. They think of someone ending up in the hospital because they have assault-related injuries. And although these immediate effects are devastating and life-changing, there are other chronic health outcomes that are associated with experiencing intimate partner violences, such as conditions affecting the heart, digestive system, reproductive system, muscle and bones, as well as the nervous system. Psychologically, IPV victims experience depression and PTSD as a result of their abuse. Living in a state of hyper-awareness and fear has shown to dramatically affect the mental health of IPV victims, causing symptoms associated with depression and PTSD. Strangulation, which is the application of pressure on the external portion of a person's neck and or upper torso in order to occlude a person's ability to breathe and their ability to allow blood to flow naturally, is often a part of IPV relationships. Non-fatal strangulation occurs in about 60% of IPV relationships, and research has shown this is to be a strong predictor of whether a victim will become a IPV homicide in the future. So research is telling us that victims are between 800 and 1,000 times more likely to become a homicide if there is strangulation present in an IPV relationship. As you can see in this picture, the victim has some petechial bruising, and that's caused by vessel constriction and bursting as a result of jugular vein occlusion. And you can see along her neck here, she has a long red mark, and that's a self-inflicted scratch as she's trying to pry the offender's hand off of her neck. And these are common injuries that you see on a neck, is the scratch marks, or you see handprints of them trying to pull and get themselves free. And so you may ask, why does the abuser use strangulation? Is he really trying to kill the victim? And oftentimes the answer to that question is no. Abusers use strangulation as a means of power and control, not as a means to kill. The power they exert over the victim communicates that the abuser has the ability to kill that person, and he has the ability to let that person live. It is a very effective method of controlling the victim because all that person wants to do is to be able to breathe again, and they will do anything in that moment to be able to breathe, and typically that's complying with their abuser. So in the previous slide, you saw a picture of a victim who had the strangulation marks on her neck. And that picture was a very good representation of what can happen. But oftentimes a victim's neck looks just like the neck of these ladies in this slide, blank. They often have no marks and no bruising. And that's about half of all strangulations, leave absolutely no marks on the neck. And you might say, well, why only half? Well, if you look at the structure of the neck, there's not a lot of bony processes other than your spinal column that your skin can rub up against and cause a bruise. And so a lot of them leave no marks. And you can see that your blood vessels are extremely close to the surface of the skin. And to occlude those blood vessels is very easy. It takes about 4.4 pounds per square inch of pressure to occlude the jugular vein and 5 pounds per square inch of pressure to occlude the carotid artery. And then it takes 33 pounds per square inch to occlude your larynx, which is your windpipe. And the average man's handshake is 120 pounds per square inch. So you can see that it takes very little pressure to occlude the entire neckway. So the absolute most common question that people ask when it comes to IPV relationships is, why don't the victims just leave? Why are they staying with these people that are continually hurting them and abusing them? Well, the answer to that question is very complicated for a myriad of reasons, but one is because they have formed a connection with that person. The relationship doesn't often start out violent, and an abuser doesn't enter a relationship and come out and say after a certain period of time they're going to start abusing the other person in the relationship with them. That just doesn't happen. The abusers are typically very persuasive and manipulative and make the other person believe that they are the picture perfect partner. And this is often where the cycle of abuse starts. When the violence begins, whether it's emotional or physical, the abuser is using several tactics to convince the victim to stay. After an abusive event, the abuser might come in to return and say, I'll never do it again. They make false promises to this person. I'll never do it again. This was my first time ever doing something like that. I've never hit anyone else in the future, and things like that. Or they'll rationalize their behavior towards the victim. They'll say, well, I was really upset and you shouldn't have done this, and that it wouldn't have made me have to react this certain way. They'll put the blame on the victim instead of putting it on themselves. And usually that works for the victim because it makes them feel as if they're responsible. They're in this really vulnerable state of shock that anything that the abuser says almost just makes sense to them. And not only does the abuser do everything in their power to convince the person that the behavior they're exhibiting is a fluke or even that it's an accident, but the victim's brain has already bonded to that person, to that idea of the person that they fell for. And the two things that are responsible for that are oxytocin and dopamine. Oxytocin and dopamine are automatically released into the brain as a response to neurochemical storm that is ignited by their abusive partner. Oxytocin facilitates bond, and we know oxytocin a lot of times is associated with mother and baby when a baby is born and they lock eyes for the first time. This is what cements the mother-baby bond. But it's not just for moms and babies, it's for relationships as well. And dopamine creates a craving sensation. It contributes to the behavior of staying with the abuser because dopamine makes you feel happy. It makes you feel excited. And so those two things together are chemically bonding you to someone in a way that prevents that person from easily exiting the relationship. So research suggests that brain injury caused by blows to the head and by oxygen deprivation caused by strangulation are likely ongoing health issues for many intimate partner violence survivors. And interactions with healthcare providers and other professionals and the women or men suffering from the effects of these unidentified injuries often go unnoticed. The effects of a TBI may not immediately present at the time of the assault. It could take days, weeks, or even months for the effects of a single incident to manifest. And when you have someone that is being abused habitually and frequently, these effects could be compounded to produce a more pronounced and significant manifestation of symptoms. Because of repeated physical abuse or repeated strangulations, women in this situation suffer from persistent post-concussive syndrome. And this is something that's seen in football players that have taken a lot of hits. And it causes the person that is experiencing the TBI to be impulsive, confused. They seem like they're always in a tireless fog. They have poor recall, and their memory is all over the place, and they're not putting things in the right order, or they can't remember certain things that are happening. And so when a police officer responds to a domestic violence call, they will, get the two people separately and they'll ask the victim what their story is. And a lot of the times these people cannot give them a chronological series of events. They can't accurately recall everything that has happened. And it's because their brain is in this fuzzy, foggy state. And then they'll tell them their story, and then they'll come back later and maybe their story changes a little bit, and the police are looking at this person saying, well, their story doesn't line up. It doesn't match what they told me the night it got there. And that's often because their brain has had some time to heal from being knocked around in their head a little bit. And so now they're able to think more clearly. They're in a calmer situation, something that's more controlled, where they're not in this hyper sense of awareness. And so all of these effects combine, and a lot of these people can present with traumatic brain injuries depending on how severe the violence is. So earlier when we were talking about strangulation, I mentioned that the abuser uses tactics such as power and control mechanism. So abusers use intimidation by doing psychological or even physical threats, saying that if you don't do something, then I'm gonna start hitting you, or just doing things to manipulate them, making them afraid by using gestures or throwing things, damaging their property, hurting their pets, or even just displaying their weapons. And they use isolation to control what that person does. So what the victim does, they try to keep them away from their friends, keep them away from their family, doesn't let them come and go as they please, don't let them go to work. And if they do let them go to work, they're making sure that they're monitored at all times. Then they use minimizing, making light of a situation of the physical or emotional abuse, and denies that anything illegal is happening, saying that this is completely normal. All relationships are like this. Or maybe they even say you've never been in a relationship like ours, and this is how things normally go, but you wouldn't know. Or they'll use their male privilege and make all these decisions. They'll make sure that the abuser is the one that's in control. They'll define the gender roles to make the victim subservient to the abuser, making sure that they have them under their thumb. Or they use economic abuse, where they control all of the finances, making the victim 100% dependent on the abuser, dependent on them to buy groceries, to buy clothes, to just buy the basic things that they need from day to day. And they can use coercion or threats, where they threaten to harm the person physically, they can threaten to harm their family, or they can threaten to report this person to the police for any of a great deal of reasons. And one of which that's commonly used, especially here in Texas, is that they will use their citizenship status as a means for the victim not to call the police, because they'll tell them, well, if you call the police, they're going to come and you're going to get deported, or the children are going to be taken away from you because they're going to say you're an unfit mother. They use these tactics that are really a scary reality for some people, to keep them in line. And these mechanisms are largely the same, but there are some differences when you're looking at intimate partner violence amongst LGBTQ couples. Some of the threats they could use within these relationships is outing a partner's sexual orientation or gender identity. The abusive partners, when you're in an LGBTQ relationship, may threaten to out the victims to family members, to employees, to community members, just taking that power away from the other person to own their own sexual identity. They might tell them that no one's going to help them because they're gay or bi or lesbian, transgender, or for whatever reason, because the victim deserves what's happening to them. Or they could justify the abuse with the notion that a partner is not really LGBTQ, or that the victim may once have still had relationships or express a gender identity that might be inconsistent with their definitions of those terms. And this can be both a tool in verbal or emotional abuse, as well as to keep that person out of that community that they feel like they belong to. And they could be monopolizing support resources through the manipulation of their friends and family supports, or just generating sympathy and trust in order to cut off those resources to the victim. They might try and get in with the family so that they no longer believe that this is happening. They say, well, you know, the abuser could never do that to you, even though that person is doing that. They could put on this picture and a facade amongst other people to where the victim looks like the crazy one. And this is a particular issue with members of the LGBTQ community, where they already have a limited number of resources available to them, and cutting them away from what resources they do have is further isolating. And then another tactic they can use is portraying the violence that is happening as mutual or even consensual, or as an expression of masculinity, or an expression of some other trait that they deem to be desirable. So another aspect of these complex relationships is using coercive control. This is similar to power and control, but it is more about stripping away that person's sense of self and making that person a reflection of what the abuser wants them to be. They use methods of coercion to compel obedience indirectly by, as I've said before, monopolizing resources, dictating their preferred choices. So it could be something as simple as if they go shopping and they say, you can't wear that, I'd rather for you to wear this as instead. Micro-regulating a person's behavior. It could be anything so simple as the way you do your hair, the way you do your nails, anything that you do. If they micromanage, they take away how you do everything and make it into what they want. It disassociates someone with who they thought they were, and you just become a puppet to what the abuser wants. Of course, you're depriving someone of their support that's needed to exercise their independent judgment. You're taking them away from the people that could help them make some decisions. And oftentimes coercive control is very difficult to detect. And it almost requires you looking back through a complex chain of prior events to even be able to see that, okay, the way this person acting is not the norm. And so when we discussed trauma bonds, I mentioned some people being in a cycle of abuse. And this is typically how situations occur and escalate into a IPV incident. First, there's a period of tension building where the victim sees that situation, that their situation could potentially escalate, and is in fear of what might happen to them if it does escalate. And usually during this period, the victim is really trying to calm down their person to prevent that escalation, because obviously they know that what comes next isn't isn't good. And sometimes this works and sometimes it doesn't, and it does progress to there being an incident. But this tension building phase is where they might be arguing a little bit more, or they might not be talking to each other as much. And it's just causing this disconnect within the household where that person can see that there's something that's going on. And in the event that the victim cannot keep the situation from escalating, an incident occurs and goes on to the second step. And this incident does not always have to be physical abuse. It could be any of the 4 types I mentioned at the beginning. But there's always a display of aggression or force on the part of the abuser. And after the incident, you have the reconciliation phase. The abuser either apologizes for what they said or did, blames the victims for the things having to go as far as they did. They deny that the abuse even occurred, or they discount the severity of the situation by saying it wasn't even that bad, which feeds into the insecurity of the victim and leaves the victim with doubt within themselves, saying, well, maybe it really wasn't that bad. Maybe this is just how things go, and I shouldn't have done what I did. And finally, there's the calmness after the storm. One thing I want to note is that these stages do not always occur like clockwork. An abuser and victim could move through all of these stages once a day, once a month, once a year, or it could be multiple times a month, multiple times a year, or even multiple times within a single day. The intervals are very different for people, and often they don't stay consistent for the length of a relationship, and they're different amongst different relationships. Now, due to COVID-19 and the various stay-at-home orders that have been placed, IPV has increased for several reasons. First, the victims are trapped in the house with their abusers. They have nowhere to go. There aren't a ton of options to be able to leave the house until the person can cool down, which forces them to stay in and potentially not have the opportunity to de-escalate a situation. This is a very stressful time for people, also due to financial instability caused by unemployment and partial to complete loss of incomes. There's also an immense pressure being put on parents right now to entertain and educate their children. Not only are parents trying to navigate financial stress, but now they're dealing with trying to maintain a schedule with some level of normalcy for their children. This can be particularly taxing for parents that have children that are not yet self-sufficient, and you have to constantly entertain them and make sure that they have something to do while either trying to manage working at home or figuring out how you're going to take care of your family with the loss of income. And so health officials have really emphasized the need to remain socially distanced from one another. They all say remain 6 feet apart, don't interact close with people that aren't in your household, that kind of thing. And an unintended consequences of that is that victims are being cut off from their social support systems, whether that be friends, families, coworkers, counselors, or what have you. These people are being cut off to who could offer them a safe place to stay, offer them resources. And the resources that are available are being stretched thin, and these victims now feel as though they are being further isolated. And so throughout the United States, and in this area as well, we are seeing an increase in IPV. Not only are the cases coming in more frequently, but they are increasing in severity as well. The victims reporting to our various service agencies and the hospitals are showing to be in worse shape. This could be due to all of the aforementioned reasons, in addition to a victim's fear of the hospital system at this time. Fear that the victim could come into contact with COVID is preventing some of these victims from coming to the hospital at all, or they're only coming until things have gotten really bad for them to the point where they need immediate medical attention. So these are a couple articles that were pulled from various Fort Worth DFW newspapers. The Texas nonprofits are reporting an uptick in IPV amid the COVID-19 pandemic. In Texas, 42% of requests for emergency shelter have been going unmet because of capacity issues. Just like within a store where you have to remain 6 feet apart in domestic violence shelters, they do have to keep people apart, and they have to screen for COVID and on all of that kind of stuff that's limiting the amount of space they can use for people to come in, because just like every other organization, they have to abide by these national rules as well. And while calls to the domestic violence assistance programs have increased, like I said, the severity of those calls increased as well. And not only are more people calling, but they are calling in more critical conditions. And it's really stressful for the service providers because they want to be able to help. They want to be able to get these people out of these situations. But like I said, the restrictions that are being placed make it very difficult for them to service everyone. And so the power and control dynamic has changed with COVID-19 as well. The abusers are using different tactics to remain in control of their relationship. They could be withholding necessary items such as hand sanitizers or disinfectants. They may share misinformation about the pandemic with their person they're in a relationship with in order to control or frighten them, or to even prevent them from seeking appropriate medical attention if they are having some trouble or if they have symptoms that need medical attention. And the abusive partners may be withholding their insurance cards, threatening to cancel their insurance, or preventing survivors from seeking medical attention if they need it. And so this is something that's really critical, is because if someone is sick, even if they haven't contracted COVID or they don't suspect that they've contracted COVID, if they don't have access to their medical care and they're already in a relationship where their partner is controlling all of their finances, not having their insurance cards further isolates them from a healthcare system where they might be able to trust someone and make an outcry to a health professional that could potentially refer them and get them help to some resources. And the programs that serve these survivors have been significantly impacted. The ones in Fort Worth have been very significantly impacted as well. And the shelters have been full, and they could potentially, they have in the past, they're now reopening, stopping to take intakes. For a short period of time, the domestic violence shelter here in Fort Worth was stopping to take victims because of capacity issues, and they had to restructure to meet the requirements that the COVID pandemic has put in place. And so they stopped taking people, and now they're back taking people again. So that's something that's being seen nationwide. And then the survivors who are older, if they have a chronic heart condition or lung conditions, and they are at increased risk in public places, they might not be able to get support, counseling, or even access to courthouses where they could potentially get some kind of assistance. And then the travel restrictions that are being placed throughout the entire world and the United States impact a survivor's escape or safety plan. And we'll talk a little bit about safety plans in just a second. But it may not be safe for them to use public transportation or to fly due to those restrictions, or due to some pre-existing health conditions, or just due to fear of encountering COVID. And so now they can't travel, and the abusive partner will use all of the hysteria going on in the media and twist that to make the victim feel as though the abuser is justified in isolating them further. So our safety planning is one of the most important things that someone can do when looking to move out of an IPV situation. When a victim decides that that they are ready to leave a relationship, this is the most dangerous time for a person. At this point, the abuser gets desperate and will use any means necessary to keep that person where they are. If someone cannot get in contact with IPV service organizations, they can use this information on the slide to create their own safety plan. And safety plans dramatically increases a victim's chances of being successful when they choose to leave. Oftentimes, a victim will try to leave several times before they are actually successful, and a safety plan can help reduce that number or even help them be successful on their first try. So these are the steps that Safe Haven, our local domestic violence shelter, recommends. You create a code word or an exit plan, and you find some people that can help you. And a lot of the times there are children involved in these relationships, and so you have to figure out what is going to happen with the children, where they need to go, if they need to stay or if they need to go. And a lot of people think, okay, well, the children always need to go. Well, sometimes in these relationships, the children are in no danger at all from the abuser. Sometimes they are, I will say that, but sometimes that they're not, and it's the parent that is in the most danger at that moment. And so the children might even be old enough to choose to stay, and it's the parent that wants to get out. But you'll need to decide kind of where you want to go with that and how the children will be taken care of. It's important to pack an emergency bag, something that you can grab and go that has all of your important documents, medications, some clothing, and anything that you might need in a snap to just get up and go. Notifying the police before an emergency happens is really important, letting them know that your history in the relationship and that you have concerns about being left alone in the house with your abuser during this pandemic time. Find the safest room in your home. There should be no weapons in that room, and there are ways for you to escape if need be, and then seek your social support. Find people that can help you and connect with you, keep you a little bit grounded, and ask you, is there anything that I can do for you to help you in creating a peaceful space. If you can't leave, the least you can do is have an area in your home to reflect and to be with yourself, be your calming center, an activity that gives you an escape or, something like that. And then if there's an emergency, please remember to call 911. And if you would like to talk to someone that's trained to create a safety plan, you can contact Safe Haven. It's really important if you are someone that knows someone that is in this kind of relationship, it is really important to not force someone to leave a situation before they are ready. It's important not to use shaming when discussing trying to leave. If they have children, what you don't want to do is say, do it for your kids, because that is shaming for them, and they might already be in a relationship where their abuser is using the children as a bargaining chip for them. And what you do want to do is show that person the options that are available and let them make their own choices. They're adults. They can make their own choices. Although people might mean well in trying to get them out of a situation, these victims don't need anyone else attempting to force them to do something they don't want to do. By forcing them to leave when they aren't ready, you are essentially taking all the power away from them, just as the abuser did. Let them make their own decisions. It's really about empowering the person to feel that they can do this, not telling them why they need to do it. As I've said before, these situations are always incredibly complex, and outsiders never have all of the information. It's important to give the victim the information that they need to be successful and let them decide what they want to do with it. So these are some of our community resources for intimate partner violence victims. Safe Haven is our local domestic violence sheltering organization. They have a 24-hour hotline. They do an assessment over the phone and help the victim figure out the best option for them if they need emergency placement Safe Haven does their best to try and get that person out of the situation that they're in immediately. One Safe Place is our local family justice center. They offer a lot of resources to IPV victims that do not require immediate shelter. And if someone calls Safe Haven and Safe Haven realizes that this person isn't in immediate danger, or that person just says they don't want to go into shelter, they can route them to Safe Haven, which can pick up and offer this list of services to the person based on what their needs are. And One Safe Place is the building in the Fort Worth Medical District that's on the corner of Hemp Hill and Rosedale. And it's open business hours, Monday through Friday. Both Safe Haven and One Safe Place are still servicing clients during this pandemic. They're still open and they're still trying to help people. And you can also call the National Domestic Violence Hotline. You can text their helpline, or you can even visit their website for resources. And they do have the option on their website to message someone. On there, they have people that you go onto the website and it pops up in a little box if you want to have a conversation with someone. If you are unable to speak to them and you don't want to text, you can go on the website as well. And then call the police if you're in immediate danger and you need immediate assistance. And just remember, if you are dealing with someone who is under the age of 17, it's preferable that you notify CPS. So I just want to end with this quote from Maya Angelou. This is something that's kind of been a point of clarity for all of us doing this work with IPV. Do the best you can until you know better. Then when you know better, you do better. So thank you guys so much for listening. If you have any questions at all, please feel free to contact me and I will assist you in any way that I can.